Assalamu alaikum everyone, welcome to my second video about how to take preparation for MS and FCPS. Although I didn't personally get to go to Dhaka to attend any coachings, I would highly recommend that you get into Genesis or Matrix or Dilip Sir's coaching, whichever suits you, because the exam schedules are really going to be helpful for preparing. Now for FCPS, you need, as I've already mentioned before, you need to have a clear idea of what you're dealing with. So you need to make sure your basics are correct and in the right place, because the questions are going to get twisted. So let's start from each subject. For anatomy, I recommend you read the basic, regular Datta or Bidicharasya, whatever book you prefer. Read that, but pay a special attention to the clinical boxes of each book. That's where the single best answers are going to be based on. So you want to pay attention to the clinical boxes. For example, when you're reading the lower limb and you're reading the knee joint, make sure you understand the possible scenarios in which there could be a meniscal tear, or there could be a tear of the anterior cruciate ligament. They're gonna ask you a scenario where a person is injured in sports and then he can't move, or he can't walk, or he has pain on this movement, and they're gonna ask you what is the structure most possibly injured. So make sure you read all the clinical boxes properly for any anatomy related organ or bone. And for the upper and lower limb, you need to make sure you read the common injury and the scenarios regarding those, because you're dealing with surgery. So a surgeon is most likely going to encounter accidents and trauma. And when you're reading the abdomen, make sure you pay special attention to every single thing that's inside your abdomen, basically your stomach, your spleen, your kidneys, your genitalia. One important and good thing I want to point out is that you will not have to read the female reproductive system, thank goodness for that, for FCPS. And just for FCPS, you're gonna have to read everything regarding the male genitalia and the urinary system. Urology, my dear friends, is very, very important for FCPS. Hepatobiliary system, again, very important. Everything you need and can find out from the anatomy books and also from the surgical anatomy part of Bailey and Love. Make sure you know everything by heart. That's important. Next, embryology and histology, you don't exactly need anything that's different from what you need in MS. The basic stuff, everything you've read in MBBS level, the tissue, muscle, bone, cells, functions, genetics, blah blah blah. Everything is the same, all the basic stuff. Moving on to physiology, my least favorite subject. Physiology, as I've already mentioned, is my least favorite subject for the reason that it's complicated and the questions can get twisted. So you should read whatever you want to read, Ganong or Gaiton, pick one and read to make sure you understand the topics. Once you've done that, go solve Roddy. I know it sounds very daunting and is pretty scary when you solve it at first. You won't understand any of the question explanations, and you will get them right and you'll get the explanation wrong. Trust me, just hold on, hang in there, and solve it twice. When you solve it for the second time, you're gonna get what I mean, okay? The concepts are gonna get clearer and you're gonna have a solid idea about everything and how things work. So even if it's tough, if you have the time, please make sure you read and revise Roddy twice, just to be a good doctor, if nothing else. Next comes my favorite subject, biochemistry. So for biochemistry, one mistake I made, which I would advise you not to make, is to not read ABC. The fact is, I kind of thought I lost my ABC biochemistry book until the very end of the year, that is 11 months after I gave my FCPS, I realized I should have read biochemistry from ABC. So don't make the mistake I did. If you don't have ABC biochemistry, buy one, or just borrow from somebody else. But make sure you read that. That's more than enough. That's more than you will ever need for FCPS or MS. It's pretty much the same. And now you don't need everything from biochemistry. You basically need to know a little bit about the biomolecules that we have, and you need to understand all the metabolic pathways that go on in the body, what produces what, and stuff like that. And what's important is the acid-base balance chapters, the different causes of metabolic acidosis and anion gap and stuff like that. And you also need to have a very good idea about hypokalemia, hyperkalemia, hyponatremia, hypernatremia, and the causes of it. Again, make a list of the similarities and the differences between the causes so that you don't get confused when answering them. For pharmacology, you don't need a lot, in the sense that you are going to be a surgeon, so you only need to know about the things that will help you in your career. So for general pharmacology, you need to have a good idea about everything. You could read any book that you want to read, but whenever you get confused, always make sure you check it with a legit book source like Kadzang or any other big pharmacology book that you could think of. Follow those. Otherwise, you could read it from any favorite guidebook of yours. It doesn't really make a difference. For systemic, you need to have a very good idea about the antimicrobials. Very favorite topic for FCPS and MS. You need to have a solid idea about the anesthetic agents, because as a surgeon, you are going to be involved with anesthetic agents a lot. And apart from these two, you need to have a good idea about the cardiovascular system. You need to know how the diuretics work. You need to know the anti-Parkinsonism drugs, and asthma, because it's involved with any basic surgical comorbidities is important. Diabetes, asthma, COPD, heart disease, anything that you could think of. Anticoagulants, because a lot of your patients are going to be anticoagulated during or before surgery, so anticoagulants are important. And sedatives, hypnotics, analgesics, these are very important topics because you're going to be using these, so you need to have a solid idea about these group of drugs. And anticonvulsants, not very important, but worth reading. Anticonvulsants could come in handy. Next, you need to read about the causes of specific side effects, like drugs that cause hyperglycemia, drugs that cause hyperkalemia. You need to make a list of all these things, and you need to make sure you know them. Now moving on to pathology. For systemic pathology, you don't exactly have to go through Robbins. Just read Bailey and Love systemic chapters, like hepatobiliary system, everything inside the abdomen basically, and the head injuries and the cerebral perfusion pressure and stuff like that. Read from Bailey and Love. But for the general pathology, you must read Robbins. The Holy Grail for general pathology is Robbins, so make sure you read the first few chapters of Robbins up to genetics, excluding genetics basically. So make sure you read the similarities and differences of all the cell injury adaptation, blah blah blah. It's pretty much the same as MS. There's nothing much to say about it. After you're done solving a chapter, make sure you go through SMIDI, and again, make sure you go through it twice, because although it's better and more forgiving than the stupid book Roddy, which is very, very confusing, SMIDI tends to be a little tricky too. Some of the answers you will find here will, be contrary to what we have usually learned. For example, the examples of hyponatremia can be a little confusing, but I've heard that the examiners follow this book, so make sure you read the differences and the answer explanations of each question from this book twice if possible. So for biostatistics, it's nothing much to worry about. Just buy a random guidebook from the market for biostatistics and FCPS. It basically covers everything we've learned in our MBBS terms in community medicine, so it's nothing to worry about. Just make sure you have it covered, because you will definitely get some questions, 2 to 3 every year from this topic, so make sure you have memorized it like an idiot. I mean, just kidding. Make sure you understand this well, and make sure you can answer the examples of the things, and the randomized controlled trials, and the retrospective and the prospective trials, mean, median, mode, variation, blah blah blah, you know, the stuff. So nothing more to say about this. That's it. Now, what we all have been waiting for, let's talk about surgery, the actual subject. Sad but true, you actually don't need to study much of Bailey and Love for getting into FCPS Part 1 of surgery. You don't actually have to read the textbook Bible of surgery. Ha ha ha. Bailey and Love is only important regarding the first few chapters, like the shock, hemorrhage, fluid, burn, stuff like that. You need to, some people say you should memorize the first 200 pages. I never did that, but I still passed the exam. So, you know, do what you gotta do. Make sure you have a clear idea about shock, hemorrhage, fluids and electrolytes, and burns, and the suture materials, the surgical techniques, diathermy. Make sure you have a good idea about these things, and that's where the similarities end. Now, let's talk about something unconventional. Let's talk about what you need to read from Davidson. Yes, you heard me right. To appear in FCPS Surgery Part 1, you need to study the book of medicine, Davidson. So what we need to cover from Davidson is basically some important charts. The electrolyte charts are very, very good and are high yield for FCPS. You will definitely get at least 1 or 2 questions every year from electrolytes and the causes and the management from Davidson. The respiratory stuff are important. That is the differences between the COPD, emphysema, asthma, the basic obstructive versus restrictive diseases chapter. That's very important for every year of FCPS. And the liver function tests, the hepatobiliary system is important from Davidson, the charts of different enzymes and what is raised in what condition. That's important from Davidson. That sort of comprises everything that you need to read for FCPS Part 1 exam in surgery, or any other subspecialties like neurosurgery, plastic surgery, cardiovascular and thoracic surgery, urology, orthopedics. So the questions are going to be identical for these surgery and allied branches. So I hope this helps. Now let's talk about MS. For MS, I'm going to be writing in addition to these things already written because they're pretty similar. So let's talk about anatomy. For anatomy, as before, you need to study any of these books. You need to pay attention to the clinical boxes. But the sad thing is you will have to study the female reproductive system. So let's have a moment of silence for that. Regarding urology, hepatobiliary surgery, abdomen, head, neck, and everything, it's pretty high end. You need to know a lot of anatomy, especially head, neck, like the triangles, the salivary glands, very favorite questions for MS. And for embryology and histology, you basically need to know the derivatives and the organ development times and the regular stuff. For physiology and MS, it's pretty much the same as FCPS. You need to read all the boxes and charts from Ganong and Gaiton, and you need to get this tricky book under your grasp. Now, one thing I would like to mention for anatomy in MS is that you need to read this horrible book called Lange. This is very difficult, very tricky, and most of the time you won't understand what's happening in all the questions. So make sure you read the questions with drawings and diagrams from Google or Netter, whichever book or source you want to pick. Make sure you see every answer with the diagram relevant to the question, so you would understand the difference, and you need to remember them because a lot of questions are copied straight from Lumley or Smitty or Roddy. So even though you hate the books, you gotta study them. There is no choice, really. For biochemistry, it's pretty much the same. No differences. You need to pay special attention to the metabolic pathways. Acid-base balances are very important. A few questions from biomolecules comes every year, so make sure you read that. Pharmacology is the same for MS and FCPS, nothing more to add. Pathology is also very similar. Pay special attention to the metastatic and dystrophic calcifications, the adaptations, the injuries, the examples of each, the confusing ones especially. You don't need biostat for MS, so that's yay for us. No biostat for MS. Now, surgery, again, pay special attention to the first few chapters, and you'll get an idea of what chapters pay attention to once you start solving questions for MS. Now, I haven't mentioned anything about any guide for FCPS, but now for MS you need to buy one question bank, be it a Matrix Quick Revision or Genesis Last Hour. Buy one, solve the past questions according to the chapter, and once you're done revising, buy the past 8 to 10 year questions from Ajit Supermarket or whatever and solve them, and make sure you revise them, especially on the night before the exam, because that is going to make you very happy and successful in MS, because there are a lot of repeats in MS. Now, again, from Davidson, the stupid boxes and charts unfortunately are pretty important for MS residency as well. Now let's talk about some saddening facts. OBGYN. Yes, my dear friends, you need to read obstetrics and gynecology for MS, surgery, MS, gynecology, MS, every subspecialty of surgery and gynecology, sadly. So what I did for OBGYN preparation is I just went through the past questions on Last Hour from OBGYN. I didn't have the time or the patience to go through and each particular chapter individually, because you're only going to get 3 to 4 questions maximum from obstetrics and gynecology, and there are not many repeats, so I just tried to memorize the questions as much as I could and read the causes of oligohydramnios, polyhydramnios, and IUGR, abruptio placentae, abortion, stuff like that. I just tried to read the relevant chapter from the books of only the topics that came previously. I didn't try to read anything new because it's pointless. Same goes for all the allied branches of surgery, which I'm going to talk about next. You need to read stuff from ortho, neurosurgery, urology, pediatric surgeries, and am I missing any branch here? Oh yes, ENT and eye. They don't, my pen is not working. So eye and ENT, they don't really require any attention for FCPS, but for MS, unfortunately, you have to read everything that you read in the MBBS years. So for ENT, you need to read the causes of deafness and the causes of otorrhea, rhinorrhea, and the epistaxis, and every hi-fi topic that we read in MBBS. We need to read those. Same goes for ophthalmology. You need to read the causes of cataract, uveitis, glaucoma, and blah blah blah. For MS as well, the questions are not repeated much. So what I did for all the allied subjects of surgery, I just solved the questions of the previous years, and I solved them twice, thrice, as many times as it took for me to memorize them properly. So one thing I would like to add is that if you're good with Facebook, you should try to spend some time before MS helping people solve questions in the different groups they have on Facebook for MS or MD. They help a lot. When you're actually solving something for somebody else, you are actually reading that topic as well by yourself, and you get to learn about lots of things which you didn't know. For example, I was in my home city and away from Dhaka, away from any coaching during my MS or FCPS preparation, so it helped me a lot to connect with all the students from the entire country on a platform and discuss questions with them. It really helped me, and it's something I would suggest to everybody. Help other people. It is actually going to come back to you in the form of a good result. You will be rewarded. The time spent looking for answers for somebody else is not a waste of time, trust me. So help other people, and inshallah you will be rewarded. So with this, I would like to conclude today's video. I hope this helps you, and if you have any particular questions, feel free to ask me in the comment section. And I hope this is the last video I ever make, because I'm not very good at it. So thank you everyone. I hope it helps.